This is Sarnia Lambton Daily for Friday, April 17th. Good evening, I'm Terry Doyle. The number of people who have died as a result of COVID-19 in the region has increased by 2 over the past 24 hours. Neither of the 2 deaths are related to the institutional outbreaks in the area. Over at Blue Water Health, there has been a bit of a reprieve regarding the number of patients currently in the hospital with COVID-19. That number has decreased to 16, down from the mid-20s at the beginning of the week. There has already been a significant increase in the number of tests being conducted locally. 272 COVID-19 tests were done on Thursday in Sarnia and in the county. The provincial government had been pushing for more testing, and supplies of tests have now increased. Local Medical Officer of Health Dr. Sidit Ranade says increased testing may lead to a spike in positive cases being reported in the region, but it is necessary information to have.
It's possible, especially in those people who might have mild symptoms. I think the other focus of expanding the assessment centers too, and now that we have more tests, is to really be able to test anyone who has symptoms, even if they're mild. That will give us a better clinical and population level picture of the disease. And at first, back in, what feels like months ago was actually just a few weeks ago, when there were not really a lot of tests, we were saying we really need to reserve these tests for specific purposes. Now that we have more tests and a certain amount more lab capacity, we really want to try to get as many symptomatic people as possible. So you would see, as you test more, that you would get more cases, and what you would hope that you'd also pick up some milder cases that would have otherwise gone unnoticed. When you have a person who has symptoms and you go in and you do a test on them, the test is a diagnostic test, and it's the same test that is being done as a screening test in people who have no symptoms. It is really unclear at this point how valuable the test is in people who have no symptoms. So in some sense, we're doing this to try to understand whether or not there's value in that approach. So it's difficult to say that if you had done it before, you would have saved lives. And the reason why I say that is because what we know about this disease, a virus infects your body and uses your own body cells to produce more of the virus. The test detects bits of the virus in the secretions that your body produces. So there is a period of time where you might be infected by the virus, but the virus has not actually triggered your body to produce more of it, which means that you could be infected, but the test would not necessarily show that you had virus in your secretions. So what I want to be careful with is the reassurance that might come from negative tests in people who are asymptomatic. I think you should think about this more as a baseline than as a real picture of whether or not people are infected, because the test is much more reliable when someone has symptoms and you do the test to decide whether or not they have disease. The concern here is we don't want people taking those negatives and saying, oh, well, our home is clear, everything's fine, because in a couple of days, those people who tested negative might actually show symptoms, and they would need to be retested because at that time they might be positive. So that's the only thing we have to be careful of here, is that sort of general sigh of relief that might come from a lot of negative tests in people who don't have symptoms.
Meanwhile, some Sarnia residents remain upset over the closure of the boat launch during the pandemic. The closure went into place Tuesday night. Dr. Ranade understands that having the boat launch open can send mixed signals.
I know that what they have done is also sent a letter to ask that this be a consistent approach across the province. I think that I'm not sure that the evidence is clear that it presents a major risk, but also I think that recreational boating might be inconsistent with what we're telling people to do, which is to avoid non-essential activities and stay as close to home as possible, right? So those are the two sides to that.
Sarnia Mayor Mike Bradley was on our show Tuesday and explained the decision that was made collectively by the Emergency Management Group to close the boat launch.
One of the big factors that kicked in is that Michigan actually banned all recreational boating. Just a day or two, the governor reversed herself and came out with that decision. So that's huge, because Michigan's got the most boats of any state in the United States. So it tells you how seriously they're taking this crisis. I don't know if Ontario is going to follow suit, but we felt, looking at all the other places, we looked at Owen Sound and Port Colborne and all these other places that had boat ramps, and they tried to work with the public, but what was happening over and over again was people who were not related to each other were gathering in groups that were way beyond the numbers that are under the guidelines in Ontario. So it's a common sense decision. Will it be popular? I doubt it with the people that use it. But the reality is our greater job is to protect the public and protect the public from people integrating with each other that then could turn around and infect other people.
Stay tuned. When we come back, we'll pay a virtual visit to Petrolia and check in with Sarnia Lambton MPP Bob Bailey on Sarnia Lambton Daily on your TV. Well, as we do on Fridays here on Sarnia Lambton Daily, and we took last Friday off for Good Friday, so we gave him a break as well. But it's Fridays with Bob as we head out to the home office in Petrolia, Ontario, and check in with Sarnia Lambton MPP Bob Bailey. Bob, how are you?
Good evening, Terry, and to your TV viewers. Yeah, I'm fine. We're self-isolating out here in the heart of oil town of Petrolia, and like you say, working from the home office every day. My staff, they're all working from their homes. Everybody's fine. I try to get out and walk every day for an hour if the weather permits, and keeping busy that way, and also responding. Now, yesterday was Thursday. I spent most of the day on the phone returning calls and looking up information for different people and working with my staff on that. So, and I knew tonight I had your show here, so I was trying to get prepared for this evening.
What are you hearing? You talk about returning calls. What are people, what's sort of on the mind of people right now?
Yeah, I'm glad you asked. So it's a combination, hearing from some small businesses or commercial outlets wanting to know if they're essential or if they qualify to go in and do certain maintenance work. And anyway, so explaining and looking up, researching those questions. The big one today, I think there's been a new ruling just come out earlier this morning that people that have nowhere else to go, like they've come back, let's say Florida or Arizona, they've come back to Sarnia Lambton or any place in Ontario, and they don't have a permanent residence. They're used to coming back and living in their say camper or trailer at a recreation, at a campground. It's allowed now that they're going to make an exemption for those, but only for the people that don't have a home. Not everybody can rush out there. So that's just being communicated, I think, today sometime and through the weekend, because I know we had some inquiries from campgrounds that didn't want to open because they were worried about being fined by the province and of course the municipalities because they were told not to open. So anyway, that probably will take a couple of days, but those kind of questions and questions from long-term care home providers, looking for questions to be answered about testing, COVID-19 testing, and just a myriad of questions.
Is it nice that at least these people are asking these questions because they want to comply?
Yeah, I think I'd like to commend all of our constituents here, both the people in the business community. I know this is so tough on them, but also the people that are isolating at home. And I always like to say they're safe at home. They're not stuck at home. They're safe at home, and remind myself of that once in a while when I start to get chafing at the bit a bit, that I'd like to get out and do something more than just walk around the block. But yeah, so I'm glad that so far we're not seeing what's going on in Michigan. I was watching what was going on in Detroit, and I guess Lansing actually the other day, where they're really having a pushback. I think maybe, some people think the governor in Michigan maybe overstepped or, maybe pushed it too far, what they were saying you couldn't do. And anyway, knock on wood, we haven't had that in Sarnia Lambton, or as far as I know in Ontario, and I hope that we can carry on with this until we get by this virus, till we get a handle on it. And we know we've flattened that curve even more. I think, I'd like to commend the healthcare workers here. Everyone, I don't want to start singling anyone out, but I mean, they know who they are. And I think your viewers know, of course, our nurses, our doctors, the personal support workers that are in the long-term care homes and in the hospital, the security staff, and of course the janitorial staff that keep these facilities clean, which is even more important than usual, with this COVID-19 virus and worried about contamination and cross-contamination. So, and the truck drivers and I tell you, the unsung heroes, the grocery clerks. that are on the job every day, interacting with people, even with the plexiglass screens and the pharmacists. So, I mean, once you start down that road, and another group that I thought of today, I was out for my walk and I seen a construction crew. They were putting in telecommunications cables, and it was actually for your TV and Cogeco. And so I'd like to give a shout out to all the telecommunications workers in Ontario, especially at your TV and all the other ones that are keeping the internet and the communications that we find so vital now, that we're virtually locked down in our homes with either TV, radio, or your TV and your computer. So I did want to thank them. I think they might be another one of those unsung heroes that maybe have slipped through the cracks. So if I can get it on the record now, a shout out to the telecommunications workers, especially in Sarnia Lambton, but throughout Ontario.
Yeah, without the internet working, everybody working from home would have a lot more challenges. You and I wouldn't be having this conversation as it stands right now, too. And what sort of, you talked about when you're out. I was just going to say, Bob, when you were out on your walk, you talked about running into them. And even as you're walking and you see people from across the street and things like that, and there's a quick wave and a quick hello, what do you find is sort of the spirit of the people right now?
I think everybody's pretty upbeat. I mean, I think some of them are, I don't see any frustration. I think they're happy, they're safe at home. They're with, their direct family, their loved ones. And, they're getting probably more exercise than maybe they would have got, say, a month ago, and they're able to walk together. And I see the same people every day. Some of them are twice a day they're out. And I try to do the one time, maybe an hour. And but I see lots of people jogging, riding bicycles, rollerblading. I haven't. The one young lady tried to convince me to go home and get a set and go out and rollerblade. And I said, I don't think so. Right now is not when I want to be in the hospital. If I don't want to cause any more work for the healthcare providers, they wouldn't appreciate it if I come in with a broken knee, elbow, or whatever. And so I said, maybe I'll take a pause on that till after this is over and start.
I'm sitting here, you couldn't see me, and you can't see me, and they couldn't see me on camera. When you brought up you rollerblading, I'm sorry, but I was having quite the little smirk. I don't picture Bob rollerblading. I just don't see that happening.
No, I never tried it, but what the heck? Maybe I will yet. Maybe but not now.
Someday,
right now.
Exactly. Someday with all the equipment and put some padding down and things like that. Shifting gears, let's talk about some of the provincial programs. A lot of things have rolled out and are rolling out as we continue on, and I'm sure discussions with your colleagues. What sort of jumps out to you in terms of some of the programs that are out there right now?
Yeah, something I wanted to, I'm glad you brought that up. I wanted to talk about that. I've had questions about personal protective equipment, otherwise known as PPE, and I've been assured that locally, between both Blue Water Health and the nursing homes and residential homes, the supply is adequate for a number of weeks if nothing blows up and goes crazy haywire. And they have adequate supplies. They have an emergency supply in our direct area where they can call upon. And then the long-term care homes, they have a different process, but it's available for them as well. They have one central contact who they can go to if they run short in an emergency. And a lot of them, I talked to a long-term care owner yesterday. He says minimum 3-4 weeks of supply right now, and he's also got a ton of it on back order. And of course, as you know, everybody's got PPE on back order, but there's this other emergency supply that is available, in a pinch, and it's available, and I know it's stored here within an hour's drive of Sarnia Lambton. So, and I know the hospital, Blue Water Health, they assure me that they're quite confident with that. And some of the other questions, the other big thing, because of an emergency order signed, I think it was Wednesday night now, this is Friday evening, that all the long-term care homes where there's been an outbreak or the residential sectors, and we know who they are locally. I won't go into any names, but I know they're all public. But they're starting, there's an emergency, I think they call it redeployment team from Blue Water Health, nurses, doctors, and they're on the road, and they're actually going into these institutions and settings and actually testing all the residents and the staff. So that's a process that's in place now. I think it started yesterday morning, Thursday morning, went throughout yesterday, and today's Friday. Friday evening now, but it's an ongoing again today, and I don't know what the process is. I think that we're going to hit the hot spots first, the places where there've been a Landmark, for example. We know we had a number of people there, and then Meadowview Villa and Petrolia had one staff member sent home who'd been tested, identified as positive. So they're going in there, they'll test all those folks, and then they'll hit the other ones as they develop. So that's my understanding. They're going to test all of those institutions and residential areas as time goes on.
Yeah, you mentioned the personal protective equipment. There is the drive going on tomorrow in Sarnia at Clearwater Arena as they're trying to increase the local stockpile as well. So definitely everyone is working together with that. You mentioned testing, and indeed we talked about it earlier on the show as well, that the numbers were up. They're testing more people, and I'm sure you've heard, because the Premier said it publicly, that he wanted to see more testing, and it does seem like more is happening. And I guess you've seen what the Premier, your leaders have been busy doing, and Christine Elliott, the Deputy Premier, Minister of Health. I've got to think it's quite a busy time for them.
Yeah, and Minister Fullerton, she's got long-term care homes. They've hived that off about 6 or 8 months ago, a year ago, and now I forget. And it's a good thing because, like you say, Minister Elliott, has got enough on her plate with the health and the hospital settings, and so Minister Fullerton is in charge of all the long-term care homes, and I think she's doing a great job too, trying to, if there's one spot that we're really vulnerable, it's with these long-term care homes, and that because the people, let's face it, they're elderly when they're in there, and a lot of them have other issues, with their health when they're present there, and so it's a real weak spot. And we see what's happened in Quebec, a real horror story down there. We want to make sure that we do everything we can do in Ontario to get ahead of this and stamp this out as best as possible. So I know the Premier has committed more resources there. There's going to be more money put for. Oh, that was the other main thing too, with that emergency order the other night. Staff can no longer go between different homes, like long-term care facilities or residential. They have to pick one and work there. And as I understand, the problem is working with the federal government to make sure they top up those wages to make up any difference that those staff members could lose. Because I certainly understand that they need full-time hours to get by now, and it's so important the work they're doing. So I'm not sure exactly where that's going to fall out. There'll probably be more said through the weekend as the news conferences, and I know the Premiers, Prime Minister, I think they met. I think they're meeting sometime today, like on a conference call earlier today. I haven't seen the results of that. Well, I just wanted to commend Blue Water Health and the foundation, the work that Kathy Alexander and all the people at Blue Water Health Foundation are doing on those PPE drives. And of course, all the people that have stepped up in the community, whether it's from the industry, individuals that have PPE. I can't imagine people got that much PPE in their homes, but maybe people do. It's not something that, I see you stockpiling groceries and stuff. I didn't know people had this PPE in stock at home, but apparently there are people that do. And so I commend what the foundation's doing, and all the people that have stepped up, whether it's local industry or people that are sewing masks. I know a number of people are doing this from their homes, and I bought some the other day that we have here for our home. And I know there's a number of people doing that. So anyway, that's about it for me. I guess it sounds like you're going to wrap this up for the evening.
Well, I was going to ask you before we go, though. Last weekend was Easter weekend. How was Easter weekend in the Bailey House?
It was great. They hid the Easter eggs, and Peter Rabbit was here, and I had spent most of the morning looking and found some, and my wife only let me have some of them. I didn't get to eat them all. The grandchildren got the balance of them, but I did get an adequate supply.
Sounds like it was, I'm sure,
so
little social distancing going on at the Bailey House, but worked out pretty well.
Yeah, there is a God in heaven. I did get my Easter eggs.
Awesome. Well, Bob, stay safe. Have a great weekend. We'll check in next week.
Yeah, thanks, Terry, to your TV, all your viewers out there. And remember, stay safe. And you're not stuck at home. You're safe at home.
Some great words there. Bob, we'll see you next week. That's Bob Bailey, Sarnia Lambton, MPP. More to come on Sarnia Lambton Daily on your TV. Welcome back. As we know, there have been many salutes for healthcare and other frontline workers taking place throughout the pandemic. As we see in this story, there is even a way to get four-legged friends involved in the appreciation.
Like many other local businesses, Touch Animal Rehabilitation is closed due to the coronavirus pandemic, but that's not stopping them from their outreach to the community, especially the frontline workers.
So we came up with the idea of Honk for Hope by everybody banging pots and pans and making sound on their decks and stuff in support of the frontline workers.
Now you've incorporated our canine friends into this. How?
We needed to come up with an idea for them to make noise, something audible in support of our frontline workers. So I actually taught my dog Percy to honk a bike horn. So we're giving steps right now to teach other people how to do the same.
If you could give us the Coles Notes version of how to train your dog to honk a horn.
I do it in various steps. Each dog learns differently. I guess step number one would be my dog understanding they need to interact with this bike horn. So touching it, maybe not necessarily an open mouth on the horn, but just simply touching it with their nose. After a few sessions of that, and my dog understands that the horn is the winner, I kind of withhold food and reward and look for them to maybe get a little bit annoyed and open a mouth, put it on the horn, that kind of thing. You can kind of train it through play as well, just interacting with your dog, moving the horn around, and hopefully getting them to lock their teeth onto it.
Do you believe that any household pet of the canine variety could do this with the proper training?
Absolutely. So any age, any size, obviously a smaller dog, you're going to want a smaller horn. Something like a Chihuahua is going to definitely need a smaller horn. You don't want something too large for them, but any age, any breed can do it, absolutely.
Laurel Dutrasac is the owner of Touch Animal Rehabilitation on Front Street.
What we are doing is going live to promote the training aspect of it. So our trainer will provide the training involved in teaching your dog how to do that. And then with that, we're hoping that we will then see people out on their balcony with their dogs, getting them to honk their horn at that kind of 7:30 time frame where everybody seems to be doing this. We're also going to, as part of our Touch community, put out a challenge to all the people that have attended our classes and just clients of ours to try and do this training. And we'll have a prize at the end of some yummy treats that have been donated by Lisa's Doghouse.
Yes. So that's how we kind of progress it.
That's going to do it for our show tonight. We are off here for the weekend. Be sure to check out the Your TV Sarnia social media channels on Facebook and Twitter for updates. But for now, I'm Terry Doyle. Have a good and safe weekend. We will see you Monday.